This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am VC Pramod and with me is Vaibhav Srivastav. The headlines. Government appeals people to avoid religious congregation and adhere to social distancing during the lockdown. Railways to modify 20,000 coaches to prepare over 3 lakh isolation beds. Cabinet Secretary asks states for intensive contact tracing of Tablighi Jamaat participants. HRD Minister Ramesh Pokhriyal Nishank instructs IITs to conduct active research work in the area of COVID-19. UN Secretary General Antonio Guterres terms COVID-19 a human crisis, calls for coordinated, inclusive and innovative action to combat the pandemic. The government today said positive cases of coronavirus in the country has increased and states have been asked to launch intensive drive to trace the suspected contacts. Briefing media in New Delhi, Joint Secretary in Health and Family Welfare Love Agarwal said movement of the people associated with Tablighi Jamaat at Nizamuddin in the national capital has increased the number of cases in the country. Mr. Agarwal said 1,800 people have been hospitalized and sent for quarantine. He appealed that religious congregation should be avoided and social distancing should be adhered during lockdown.
लॉकडाउन की परिस्थिति में हमारे जो इंस्ट्रक्शंस हैं, हमारी डायरेक्शंस हैं, वो यही हैं कि किसी भी तरह का कांग्रीगेशन अवॉइड करना चाहिए, धार्मिक सभाओं को अवॉइड करना चाहिए. हम चाहते हैं कि सब लोगों की सुरक्षा के लिए सोशल डिस्टेंसिंग के जो मेजर्स हैं, जो उससे संबंधित डायरेक्शंस हैं, उनका 100% अमल हो.
Mr. Agarwal said Railway is preparing more than 3 lakh isolation beds, for which work has been started to modify 20,000 coaches.
भारतीय रेल 3.2 लाख आइसोलेशन और क्वारंटाइन बेड्स बनाने के लिए प्रिपरेशन कर रही है, जिसके तहत 20,000 कोचेज को मॉडिफाई करने का कार्यक्रम शुरू किया गया है. इसी के तहत 5,000 कोचेज को मॉडिफिकेशन शुरू की जा चुकी है, जिसके थ्रू हमें 80,000 नए आइसोलेशन बेड्स प्राप्त होंगे.
The Joint Secretary said government is regulating 24 class of medical devices which have been notified and regulated as drugs under Drugs and Cosmetics Act 1940 and Drugs and Cosmetic Rules 1945. He said no manufacturer and importer can increase the MRP of a drug more than 10% of MRP during the preceding 12 months. He said the step has been taken to provide the medicines and devices at affordable rates to the people. Mr. Agarwal said Supreme Court has directed the states to make arrangements of counsellors at relief camps. He said on the direction of the Apex Court, an email ID technicalquery.covid19@gov.in has been created by the Health and Family Welfare Ministry to resolve the technical queries. Joint Secretary, Ministry of Home Affairs, Punya Salila Srivastav said that efforts have been made by the states and union territories to provide essential items to the people. She said 21,486 relief camps have been set up in the country, while meals are being provided to 25 lakh people.
माइग्रेंट वर्कर्स के लिए स्टेट्स और यूटीज फूड और शेल्टर की व्यवस्था कर रही हैं. अपडेटेड फिगर्स के अनुसार 21,486 रिलीफ कैंप सेटअप हुए हैं, जिसमें 6,75,193 पर्सन्स को शेल्टर दिया जा रहा है और लगभग 25 लाख लोगों को मील्स दिए गए हैं.
She said Cabinet Secretary today held a discussion with the Chief Secretaries of States and reiterated that cargo movement should be hassle-free and this must be effectively transmitted to the ground level. She said Cabinet Secretary requested the states to expedite the implementation of Prime Minister Garib Kalyan Yojana. Head Scientist ICMR Delhi Raman R. Gangakhedkar said 47,951 tests have been conducted so far and the current capacity utilization of the labs is 38%. He said ICMR has given approval to 126 government laboratories and 51 private laboratories to conduct the tests. He said total 4,562 tests have been conducted yesterday, including 816 by the private laboratories. Meanwhile, 386 new cases of COVID-19 were reported in the last 24 hours, taking the total number of cases to 1,637 in the country. According to Health Ministry, death toll due to coronavirus has risen to 38 in the country, while 133 patients have been cured and discharged.
Cabinet Secretary Rajiv Gauba today took a meeting by video conferencing with all the Chief Secretaries and Director General of Police of the states. The states were sensitized about the intensive contact tracing of Tablighi Jamaat participants, as this has increased the risk of containment efforts of COVID-19. The states were asked to complete the contact tracing process on a war footing. It has been found that foreigners who had participated in the Tablighi Jamaat had violated visa conditions. The states were asked to initiate action for violation of visa conditions against the foreigners and the organizers of the event. The states were also asked to implement the PM Garib Kalyan Yojana within the next week. The centre has asked states and union territories to strictly implement lockdown measures in the letter and spirit. In a letter to state chief secretaries and union territory administrators, Home Secretary Ajay Bhalla said it has been noticed that some states and UTs are allowing exceptions beyond what has been permitted under the lockdown. He said this amounts to violation of the lockdown measures announced by the centre under the Disaster Management Act and may defeat the overall objective of containing the spread of COVID-19.
Defence Minister Rajnath Singh today reviewed his ministry's efforts to fight COVID-19. Mr. Singh directed all organizations to redouble efforts in assisting civilian authorities. He appreciated the efforts being made by various services, organizations and defence public sector undertakings in terms of evacuation, provision of healthcare in quarantine facilities. Chief of Defence Staff General Bipin Rawat informed the ministry that separate hospitals have been identified to exclusively deal with COVID-19. Chief of Naval Staff Admiral Karambir Singh informed that naval ships are on standby to extend any required assistance. Chief of Air Staff Air Chief Marshal R.K.S. Bhadoria informed that the Air Force planes conducted several sorties within the country in the last 5 days to transport approximately 25 tons of medical supplies. Chief of Army Staff General M.M. Naravane informed that over 8,500 doctors and support staff are available to extend necessary assistance to civilian administration.
Union Health Minister Dr. Harshvardhan today reviewed the actions taken and preparedness on novel coronavirus with the Indian Medical Association at a high-level meeting through video conferencing in New Delhi. During the meeting, he reviewed the preparedness and concerns of medical staff across the country related to COVID-19. They were informed about the current scenario in the country, various guidelines, treatment and protocols. Doctors from states including Delhi, Kerala, Jharkhand, Maharashtra, Kerala, Punjab, Andhra Pradesh, Rajasthan, Odisha, Gujarat, Telangana and Uttarakhand participated in the video conferencing. The minister reviewed the status of the preparedness in terms of availability of beds, isolation wards, laboratory readiness for high test volumes. He also exhorted Indian Medical Association and its regional members to make a task force and take proactive role in helping the official machinery at state, district and local levels.
In the wake of COVID-19, the central government has taken several measures to ensure uninterrupted supply of essential items so that people should not face any difficulties. More from our correspondent.
Cargo flights are carrying medical supplies to eastern, northeastern and southern parts of the country. The private airlines like Indigo, SpiceJet and Blue Dart are also carrying out critical supplies. The cargo essentially covered COVID-19 related medical equipment, testing kits, PPE, masks, gloves and other items requisitioned by states and union territories. Nearly 38 tons of cargo has been transported till date. Besides, government is also regulating 24 classes of medical devices which have been notified and regulated as drugs. National Pharmaceutical Pricing Authority is currently monitoring MRPs to ensure that no manufacturer and importers can increase the price more than 10% in preceding 12 months. We in radio are giving you updates. You stay home and stay safe. With Divakar, Saubhagya, Air News, Delhi.
Haryana Home Minister Anil Vij today said that there are around 500 people, including 72 foreign nationals in the state, who attended the religious congregation held at Nizamuddin in Delhi. He said the Health and Police Department is tracing them and keeping in quarantine. Meanwhile, the Director of Health Department, Dr. Usha Gupta, has said that so far 132 persons have been traced and kept in quarantine, and most of them were staying in the mosques. She said that 82 of them have been sampled for testing.
Pune administration has received a list of 182 persons from the region who had joined the Tablighi Jamaat rally at Nizamuddin in Delhi. Divisional Commissioner Dr. Deepak Masairkar said that 106 people from this list have been identified. Out of the 106 identified people, 94 have been quarantined and further action will be taken on receipt of the swab test report. Dr. Masairkar said that out of 182 persons from the list, 136 are from Pune district, 5 from Satara, 3 from Sangli, 17 from Solapur and 21 from Kolhapur district. He said the search for the remaining people on the list is in full swing.
In Tamil Nadu, the number of COVID-19 cases has gone up to 234 as 110 people have been confirmed with the virus today. This is the biggest jump on a single day since the outbreak of the pandemic. The state government has appealed to all those who attended the religious conference held at Nizamuddin in Delhi to voluntarily report themselves for medical checkup. Talking to reporters in Chennai this evening, Revenue Minister Uday Kumar said that 1,122 people from the state are known to have attended the event, of whom 711 returned to the state. All except 91 of them have been traced and quarantined, and intense efforts are on to trace those who remain incommunicado. Our correspondent reports that the people directed to be under home quarantine in the state has gone up to more than 88,500.
The Tamil Nadu Disaster Management Authority has identified over 43,400 first responders to report to the authorities and do the follow-up on cases showing symptoms of the viral infection in their localities. Moreover, the State Disaster Response Force personnel have been deployed in all the cities in the state, including Chennai, Trichy, Madurai and Coimbatore, besides the district, to help the health, revenue and police authorities in the works relating to tackling the COVID-19 menace. Meanwhile, monitoring the people's movement has been tightened in the state to implement the lockdown strictly. Nearly 14.5 lakh rupees has been collected by the state police as fine for defying the restrictions under Section 144, and 34,000 cases have been booked till this morning. A statement by the state police headquarters says over 38,000 people have been arrested and more than 28,000 vehicles seized so far. Jai Singh, AER News, Chennai.
More COVID-19 positive cases confirmed in Kerala today. We have a report from our correspondent.
24 more COVID-19 positive cases are confirmed in Kerala today, among which 9 people returned from other countries. Out of 265 cases reported in Kerala, 195 people had returned from abroad and 67 got it from primary contact. Chief Minister Pinarayi Vijayan said that within 4 days, Kasaragod Medical College will be converted to exclusive COVID hospital. On the first day of free ration distribution today, over 14 lakh people collected ration. Chief Minister said that the lockdown guidelines need to be followed strictly for the coming days too to contain the infection. Mayusha for AR News from Thiruvananthapuram.
In Uttar Pradesh, over 1,67 lakh beneficiaries took the ration from around 80,000 PDS shops in the state today. The state government has also decided to open the OPD of government hospitals also so that normal public can get proper medical care. Details from our correspondent.
Chief Minister Yogi Adityanath today instructed officials to start the OPD services in hospitals and strictly follow the guidelines of Health Department and social distancing norms so that patients can get treatment. He also suggested that if need arises, then advice to the patients can be given on phone also. Chief Minister instructed that apart from ensuring food in shelter homes, there should be regular sanitation drives by municipal corporation. Meanwhile, state government today distributed around 95,000 metric ton food grains from the PDS shops, and this will continue till 9 p.m. Antyodaya and BPL card holders along with Manrega workers and registered laborers were given free ration. Production of sanitizer has also started in 48 sugar mills and more than 1,28,000 litre sanitizer has been procured till date. Sushil Chandra Tiwari, AIR News, Lucknow.
This is All India Radio bringing you a special program on COVID-19. A reminder of the headlines before we move on. Government appeals people to avoid religious congregation and adhere to social distancing during the lockdown. Railways to modify 20,000 coaches to prepare over 3 lakh isolation beds. Cabinet Secretary asks states for intensive contact tracing of Tablighi Jamaat participants. HRD Minister Ramesh Pokhriyal Nishank instructs IITs to conduct active research work in the area of COVID-19. UN Secretary General Antonio Guterres terms COVID-19 a human crisis, calls for coordinated, inclusive and innovative action to combat pandemic. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Human Resource Development Minister Ramesh Pokhriyal Nishank has instructed the Indian Institute of Technology IITs to ensure that they should conduct active research work in the area of COVID-19. Mr. Nishank said this while chairing a meeting with all the directors of 23 Indian Institutes of Technology through video conferencing in New Delhi today. He said the research work which is already being done should be given wider publicity in social media and other mediums. Mr. Pokhriyal also directed the institutes to ensure that maximum number of students are covered through online courses. The institutes have been asked to place the courses on online education portals Swayam and Swayam Prabha. The minister also asked the directors of institutes to take care of the students, faculty and their family members and ensure that they should not be facing any problem.
In view of the COVID-19 outbreak, the Central Board of Secondary Education CBSE will conduct Class 10 and 12 examinations only for 29 main subjects which are crucial for promotion and admission to higher educational institutions. Human Resource Development Minister Ramesh Pokhriyal Nishank said he has advised the board in this regard. He said for the rest of the subjects, CBSE will not hold board exams and instructions for their marking assessment will be issued soon. He also directed CBSE to promote all students of classes 1 to 8 to the next class in view of COVID-19 situation. The minister said the students of class 9 and 11 will be promoted to the next class based on the school-based assessments including projects, periodic tests and term exams conducted so far. Those in class 9 and 11 who are not promoted this time can appear in school-based tests online or offline.
In an effort to guard against fake news being circulated on various platforms, we bring you a segment on fact-checking and mythbusters. Dr. K. Srinath Reddy, President of the Public Health Foundation of India and former head of the Department of Cardiology at AIIMS in New Delhi, urged everyone to follow stay-at-home direction of the government during the lockdown to fight COVID-19. Speaking to All India Radio, Dr. Reddy emphasized on social distancing to prevent the virus outbreak.
ये वायरस बहुत जल्दी से फैलता है और खास करके खांसी में जो ड्रॉपलेट्स निकलते हैं एक आदमी से दूसरे आदमी तक पहुंच जाते हैं। अगर हम 6 फुट का फासला रखें, ये बूंद जो है वो दूसरे आदमी के ऊपर नहीं आएंगे या दूसरे आदमी से हमारे ऊपर नहीं आएंगे, तो इसीलिए सोशल डिस्टेंसिंग रखना बिल्कुल आवश्यक है।
The government has come across reports in a section of social media which purportedly claims that Indian citizens are safe because of microRNA in their genome. The report misinterprets the work carried out at the International Center for Genetic Engineering and Biotechnology in this regard. This is a fake news. No such claim has been made by the International Center for Genetic Engineering and Biotechnology, ICGEB, that a microRNA is unique to Indians as mentioned in the video. No analysis of DNA or RNA of patient samples as mentioned in the purported video audio has been carried by the Delhi-based group at the ICGEB in this regard. Group leader of the Translational Division, Dr. Dinesh Gupta, told All India Radio News that the centre used computational biology in this study. The research by the group of scientists can't be used to conclude anything concrete about the lethality and transmission of the coronavirus or resistance of the population in India as claimed in the video. The video audio is perpetuating a totally misleading interpretation. It is not only unethical but also dangerous in this crisis as it gives a false sense of security to the Indian citizens. Be aware of any such misleading information and do not fall for it. Stay home, stay safe. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Randeep Guleria, Director AIIMS, suggested that at this time there is nothing better than staying at home to curb the spread of COVID-19 infection.
Today there is nothing better than staying at home for the safety of your loved one. Be part of the cure, not part of the disease.
To listen to other experts, tune in to our next bulletin. From tomorrow, News Services Division of All India Radio is extending all 5-minute bulletins of Hindi and English to 10 minutes. The timings of Urdu bulletins will be 9 a.m. and 9 p.m. Indian Farmers Fertilizer Cooperative Limited, IFCO, contributed 25 crore rupees to the PM CARES Fund. IFCO, which has always delivered its best in the service of the nation by serving the farmers in rural areas of the country, is also contributing at ground zero by distributing masks, hand sanitizers and disinfectant soaps to farmers. Our correspondent reports IFCO is also distributing vitamin C tablets and essential food kits to the farmers and villagers at various places across the country.
IFFCO's 5 fertilizer units in the country are functional and continuously operating in shifts to produce the fertilizers and essential soil nutrients so that this pandemic does not affect the agriculture activities of the country.
Delhi Chief Minister Arvind Kejriwal today announced 1 crore rupees for the families of healthcare personnel if they lose their lives while dealing with COVID-19 cases. The personnel include all sanitation workers, doctors and nurses from private or government sector, be it temporary or permanent. Interacting with doctors through video conferencing, Mr. Kejriwal termed their contribution as no less than a soldier and saluted their courage and dedication. Later, addressing the media, the Chief Minister said COVID-19 has not reached the stage of community transmission in Delhi and the situation is under control. Mr. Kejriwal also said the government will track mobile phones of people under quarantine to check their movement, and it has given 14,345 phone numbers to Delhi police.
Himachal Pradesh government has decided to facilitate industrial houses to start their operations in the state. All the industrial units of the state would be provided an auto extension of various approvals. Our correspondent has filed this report.
Interacting with the industrial houses through video conferencing, Chief Minister Jairam Thakur said state government would ensure that the industrial houses, particularly in Baddi, Barotiwala and Nalagarh area, would be facilitated to start their operations. He further said the state government would take all necessary steps for smooth movement of the workforce besides strengthening the supply chain of raw material and furnished goods from the industries. He also appreciated the efforts of Industrial Association for providing dry and cooked ration to the workers stranded in Baddi, Barotiwala and Nalagarh area. Meanwhile, 250 pharma industries in the state have resumed the production in the majority of their units. On the other hand, to ensure social distancing amongst the people in the wake of COVID-19 pandemic, the State Information Technology Department has developed the mechanism of e-passes to facilitate the people. Sanjeev Sundariyal, AIR News, Shimla.
The Gujarat government has announced various farmer-centric decisions in view of the COVID-19 outbreak in the state. The government announced to extend the last date for the repayment of short-term agricultural loans from 31st March to 31st May. Here is a report from our correspondent.
Briefing the media today, Deputy Chief Minister Nitin Patel said the decision was taken in view of the lockdown situation where farmers are not able to sell their produce. He said around 21,21,000 farmers will be benefited from the decision. Deputy CM also informed that this interest subsidy of 7%, which is shared by central and state government, will also be continued in the extended period. Mr. Patel added that the state government also decided to continue the service of all the employees of health department who got retired yesterday in the wake of coronavirus pandemic. Aparna Khun, AR News, Ahmedabad.
The Madhya Pradesh government has decided to give contractual appointment of 3 months to those officers and employees who are working diligently in the current coronavirus crisis in the state and retired on 31st of last month. The state government has also given authority to divisional commissioners to engage contractual persons for 3 months. Official sources mentioned that this will help in getting services of efficient officers and employees in combating present COVID-19 crisis. We have a report.
Chief Minister Shivraj Singh Chauhan transferred a total amount of 589 crore rupees online to the bank account of the beneficiaries of various schemes. Due to the lockdown, it is not possible to provide cooked food to the students in schools under midday meal scheme. In such a situation, the government has transferred the amount of midday meals in the bank account of their parents. Similarly, amount of Unified Scholarship Scheme has also been transferred to the students' account. Sanjeev Sharma, AIR News, Bhopal.
In Maharashtra, as many as 16 people were tested positive for novel coronavirus in Mumbai today, taking the total number of cases to 167 in the metropolis itself. So far, 8 people have succumbed to the infection in the city. The state has recorded 322 COVID-19 cases and 12 deaths so far. With the rapid increase of cases in the metropolis, the administration has sealed various areas in Mumbai, Navi Mumbai, Kalyan Dombivli and Vasai Virar. The district administrations have restricted movement of people in these areas. We have a report.
The state authorities have so far identified at least 25 people from Mumbra in Thane district who had attended a religious event in Nizamuddin area of Delhi last month. Dr. R.T. Kendre, officer on special duty in charge for coronavirus cases for Thane, said on the directions from the center, a team of 7 to 8 medical officials has been deployed along with the police to carry out inspection and for identifying those who had attended the event. Besides, 35 people who attended the event have been traced from Ahmednagar district. Meanwhile, the BMC has issued a circular stating that vacant properties will be used to quarantine those who are suspected to have been exposed to novel coronavirus. As per the circular, officials will provide food and basic arrangements at these quarantine facilities. Kunal Shinde, AIR News, Mumbai.
In the COVID-19 crisis, if a worst-case scenario is assumed, about 0.006% of the population will require critical care with access to ventilators. For a population of 125 crores, this translates to about 75,000 patients who might need ventilator access. In a large country like India, the biggest challenge is the manufacturing of such ventilators on a mass scale due to limited access to pneumatic and electronic hardware, sensors and actuators in the global marketplace. The global supply chain has been severely disrupted due to the crisis, and there are no indications on when it will be restored. Hence, a group of scientists and students in Indian Institute of Science in Bangalore have developed an indigenous ventilator prototype. More from our correspondent.
The scientists and students in Indian Institute of Science have developed a prototype of an indigenous ventilator under Project Prana. The project is a voluntary effort to help the nation at the time of crisis. The team in the Electrical Communication Engineering Department of Indian Institute of Science, led by Associate Professor Gaurav Banerjee, has designed the ventilator using materials readily available in India. More on this from Associate Professor Gaurav Banerjee.
One of the biggest challenges that will be faced by Indian manufacturers is that the designs that are already available, either as open source designs or designs from manufacturers already in India, have a heavy reliance on sensors which are available in the international markets. This is a completely made in India design, built from the ground up, which uses components that are available in the Indian supply chain in large numbers. And the project endeavors to use most components which are actually built in India or made in India. And a very small number of components may be sourced from outside, but they're already available in large numbers in India.
The prototype has mass flow sensors and controllers which accurately tell how much oxygen is flowing and what volume the patient is inhaling in one breath. Pneumatics is built around mass-produced water filter hardware. The control system is built around open-source industrial controller. Sudhindra, AIR News, Bengaluru.
Amidst coronavirus outbreak, actor Kriti Sanon has appealed to people to respect social distancing norms and take all precautions against the pandemic.
Guys, they're very small, basic things that we all can take care of. If you're stepping out to buy grocery, make sure that you're at least at a 6 feet distance from each other. Do not touch anything, wear a mask. Do not touch your face. Come back, wash your hands for at least 20 seconds. Sanitize everything that you've touched. अगर आप अपनी लिफ्ट में जा रहे हैं तो लिफ्ट का बटन हाथ से नहीं दबाएं, एल्बो से दबाएं. If you're a righty, use your left hand to open all the doors and turn knobs. Stay positive, stay fit, stay at home.
From tomorrow, News Services Division of All India Radio is extending all 5-minute bulletins of Hindi and English to 10 minutes. The timings of Urdu bulletins will be 9 a.m. and 9 p.m.
United Nations Secretary General Antonio Guterres has called the coronavirus pandemic the most challenging crisis the world has faced since World War II. Launching a new report titled Shared Responsibility, Global Solidarity, responding to the socio-economic impacts of COVID-19 yesterday, Mr. Guterres said that the pandemic will lead to an economic recession without any parallel in the recent past. Calling it much more than a health crisis, Mr. Guterres said that the pandemic is a human crisis which demands coordinated, decisive, inclusive and innovative policy action from the world's leading economies. He also called for maximum financial and technical support for the poorest and the most vulnerable people and countries.
The News Services Division of All India Radio, in its bilingual live phone-in program tonight, will bring you a discussion on measures to prevent COVID-19 infection under Corona Jagrukta series. This can be heard on FM Gold channel and additional frequencies from 9:10 p.m. onwards.
And now, before we end, the headlines once again. Government appeals people to avoid religious congregation and adhere to social distancing during the lockdown. Railways to modify 20,000 coaches to prepare over 3 lakh isolation beds. Cabinet Secretary asks states for intensive contact tracing of Tablighi Jamaat participants. HRD Minister Ramesh Pokhriyal Nishank instructs IITs to conduct active research work in the area of COVID-19. UN Secretary General Antonio Guterres terms COVID-19 a human crisis, calls for coordinated, inclusive and innovative action to combat the pandemic. And with that, we end the special news program on COVID-19.